Hi again, everyone. So in this video, I'm going to be narrowing down our look into self-report measures by focusing on anxiety measures. If you haven't already seen the video introducing self-report measures and talking about general instruments, I suggest you start there and then come on back here. All right, so we're going to look at measures that are designed specifically for anxiety as the mental health issue. So if you suspect that your client may have an anxiety disorder or your general screener indicated some issues with anxiety, you should use one of these. All right, so here's a list of commonly used anxiety measures. I'll go into depth on all of them with the exception of the GAD-7, which is a hospital-based screening instrument, meaning you're unlikely to use it in your community-based work. We'll start with the Beck Anxiety Inventory. So the Beck Anxiety Inventory is a 21-question self-report measure that assesses for the common symptoms of anxiety, such as feeling fear for the worst happening, as well as common panic attack symptoms like heart racing, feeling unsteady, terrified, and so on. Each response that the client provides is assigned a score. They don't show the scores on here, though, as you can see. They only give you the answer choices, not at all, mildly, moderately, severely. But each of these corresponds to a number that you would then use for scoring. So not at all is a 0, mildly is a 1, moderately is a 2, and severely is a 3. So for example, someone who selected mildly for numbness or tingling would be scored a 1. Okay. You'll then sum up all of the points for the 21 questions and interpret the score accordingly. 0 to 21 being low anxiety, 22 to 35 moderate, and over 36 high anxiety may be severe. You can also utilize specific items to assess certain clinical clusters, as you can see listed on the right. So the neurophysiological symptoms would include things like numbness and tingling, being unsteady, and so on. So neurophysiological symptoms, basically. Subjective would include things like feeling terrified and feeling like the worst is happening. So that has to do with the client's perception. Panic involves symptoms associated with panic, like fear of dying. And finally, autonomic includes things like indigestion problems, sweating, feeling hot, and so on. One thing or one issue to be mindful of here is that this measure, the Beck Anxiety Inventory, has been critiqued for not adequately differentiating between anxiety and depression. So although the summed scoring can be very helpful for diagnostic purposes, be sure to go back and look at the specific items to see what the client is endorsing as being symptoms that affect them the most. That's going to give you some good information and help you decide for diagnosing. Okay. All right, next we have the Burns Anxiety Inventory, not to be confused with the Beck Anxiety Inventory that we just looked at. This one is a 33-item self-report measure that's divided into 3 categories. And what's nice about this is that these 3 categories are consistent with a CBT approach. So if you're a CBT clinician, this might be a great tool for you. So those 3 categories are anxious feelings, anxious thoughts, and physical symptoms of anxiety. As you can see on the screenshot here, numbers or scores are assigned to each selection, and then you sum the total, okay? So for number 1, which is anxiety, nervousness, worry, or fear, if the client selects moderately, that's a 2, and you would just score that up. So they're checking it off, and you are adding. This is asking about symptoms in the past week, so that's helpful to keep in mind as well. Okay, so each summed total, so once you've added everything up, you would then look at the scoring breakdown here. And the scores give you a certain level of anxiety or a certain level of distress associated with anxiety, which can be helpful for diagnosing and can help to justify your diagnosis when you're looking at an anxiety disorder. So that is the Burns Anxiety Inventory. Next is the State Trait Anxiety Inventory, and this is a 40-item Likert type scale with scoring that's specific to each item. So what that means is each item is not going to be scored in the same way. Not at all for one item might be scored a 0, but not at all for another item might be scored a 4. And the reason is just based on how the question is worded, okay? And it helps to keep your clients from going and just checking off 0, 0, 0, 0 the whole way. Okay. So this measure is unique and it's commonly used because it splits anxiety into state anxiety, which is a more temporary anxiety in the moment type of thing, from trait anxiety, which is a more characteristic or trait of the person, like someone who's just always perpetually anxious. Okay, so that's kind of unique and gives you another perspective at looking at their anxiety and how it affects them. Okay, so for scoring, as I mentioned, you can see that each question corresponds to a specific scoring pattern, and the scoring is on the bottom, listed there. And so, for example, for question 1, a not at all is a 4, somewhat is a 3, moderate is a 2, very much is a 1, okay? Whereas for question 3, it's in reverse, okay? So when you're scoring this, you'll need to consult the scoring sheet so that you interpret the scores correctly, all right? Another thing is this measure doesn't provide clinical cutoffs the way that the Burns Anxiety Inventory and the Beck Anxiety Inventory did. It only tells you scores, okay? And it only tells you, and it also tells you that low scores are indicative of low or mild anxiety. Middle scores moderate, high scores high, and you get the picture. And so you do not definitely need to use more of your clinical judgment here, and definitely go back and look at the items that were endorsed. Okay, this one here is the Hamilton Anxiety Rating Scale, which is the final one that I'll be going over for anxiety. And what's unique about this measure is that it's not actually completed by the client. So it's not a self-report measure technically. Instead, it's completed by you, the therapist, okay? After completing your diagnostic interview with the client or doing your intake, you would then go to this and basically score the client based off of what they've told you, okay? And then you would sum up everything. You could also, just like with any other measure, use this as a guide for questioning. So you can have this in front of you and modify the questions so that they are questions you can ask in therapy. So for number 1, anxious mood, worries, anticipation of the worst, fearful anticipation, irritability, you could turn that into a clinical question by saying, tell me about situations when you feel very worried and expect the worst, or something like that. Or do you have moments in your life when you feel very anxious and fearful? Do you have moments in your life when you feel irritable? Tell me about those, or what have you. So this can be used in that way as well. Okay, the scores correspond to a level of anxiety, as you can see here, and it's pretty straightforward. Okay. So those are all of the anxiety measures that I'm going to be going over. There are plenty of others that you could find and use if you want. So I tried to just give you the most common ones. But regardless of what you end up picking, make sure to familiarize yourself with the measure before you administer it. This is helpful in the event that the client has questions about the measure. You don't want to be confused because you've never looked at it before. You want to be able to help the client out and understand what's being asked. Also remember, as I mentioned, that you can use any of these measures or any of the measures that you find in your own searching to guide your diagnostic interview instead of giving them to the client to complete. If you're more of a fan of an interview style assessment instead of self-report measure, or your client is not interested in doing a self-report measure or what have you, that's always an option. All right, so that's it for anxiety. In the next video, I'll be doing depression. So be sure to take a look at that and let me know if you have any questions or need clarification. Thanks for listening, everyone.